I founded this Clinic of Hope in 1991 when I retired from the medical school.
There was a time Professor went on the air and talked about his Vanivax. Then there are so many people who ask from friends and they'll tell them about the clinic. And there are some good colleagues who know that immunotherapy is being carried out here, and if they find patients who are HIV positive, they won't allow them to get down the 6th stage before coming here. So they send them here.
More patients are coming now because of the news they're getting, so they come for treatment too.
The most important thing I've learned from being in the clinic is that it's a normal disease like any other diseases. Because you see here in our clinic, we feel very free with our patients. We don't stigmatize them. We play around with them. We talk. They are normal people like us.
In 1972, Professor Nomangu won the Lasker Prize, the American equivalent of the Nobel Prize, for his clinical research contribution to the successful chemotherapeutic treatment of Burkitt's lymphoma. Today, Professor Nomangu doesn't use chemotherapy. He uses Vanivax.
What we are doing here is that we are using the patient's immune system to deal with the problem. Okay? Burkitt lymphoma, it's viral related. The tumor is as a result of Epstein-Barr virus. And so what we do, we collect the blood and we prepare a vaccine to, sensitize the patient's immune system to be able to take care of the tumor. It's better as opposed to other toxic, agents like forms of treating it like chemotherapy, where you may lose your hair, depresses your bone marrow, it causes a lot of toxicity to the body. So in this system, you use your own system to deal with the problem.
I think, honestly, that immunotherapy or the treatment of many diseases can be carried out using immunotherapy. Cancers, HIV, of course, hepatitis B, hepatitis C, many of the tumors that exist without retrovirus, one can treat them. And one will eventually treat all of them, I think, by vaccines, therapeutic vaccines, instead of drugs.
I think that one question that we cannot answer yet with this method is, why do some people respond so well and others not so well? Yeah, I think this has to also be recognized. It is something that he's constantly asking himself and trying to get solutions to it by either modifying his treatment procedure and so forth.
No, there's no doubt that we had some failures. Some of them partly ours, some of them, of course, the patients and whatever. But most of the time we want to look at more the problems as being us, so we work harder, because that's what actually makes us work harder.
The definition of HIV positive is that the virus is present in the body. The definition of HIV negative is that the virus is not present. There are two tests to determine the progression of HIV and gauge the efficacy of the treatment: the CD4 count and the viral load in the blood. The CD4s are the specific cells of the immune system that attack the HIV. The viral load is the relative estimate of the amount of virus detectable in the blood. A Sero-Conversion from HIV positive to HIV negative is when the virus is no longer detectable. Giselle is studying philosophy at the University of Yaoundé. Her health took a dramatic turn for the worse several months after testing positive.
No hay una solución. Sí, y cuando estoy, no puedo marchar también. No puedo marchar, no puedo comer, no puedo hacer nada. Es a partir de este momento que me ha poniendo en el CHU, el hospital CHU, y donde he visto el profesor Nomangu, que cuando él cuando el profesor Berme dice que Giselle, esta enfermedad va a quitar con tu cuerpo. Me han dicho, yo digo que profesor, no es la verdad. Sí, es la verdad. Y mi madre está llorando. Pregunta a los profesores, profesor, Giselle, pienso que Giselle va a morir. El profesor dice que no, ella no puede morir. Ella va a vivir. Hay que esperar.
Alexi is a new patient at the Clinic of Hope and is having her first consultation with Dr. Ambe.
Her fiancé, the father of her 2 children, happened to have already been found positive and was receiving treatment here in this clinic. You know, she developed the courage to go ahead and screen for herself since she was already placed in a risky zone. But however, I want her to deliberately respect the hygiene of life, to eat clean food, to have enough water, to get fruit juice, to get vegetables and fruits, and not to be careful about her sexual life so that she doesn't get contaminated again or contaminate some other person.
Okay, hay mucha gente que vivo antes que ha muriendo con esta HIV. Sí, y pienso que voy a morir también, pero no es la realidad porque estaba muy... he perdido muchos kilos y mi piel está muy mi piel está muy mal, mi cabello se corta, todo se corta y no puedo marchar, pero antes que el profesor se ha preocupado con mi salud y estoy muy bien.